Hi viewers, this is the part 3 of our stereo-based clinical question and we will start right from the question number 11 where we left in our last video. So here is the case scenario on your screen. A football player who complains of burning pain in the supraclavicular area that radiates down to the arm and is diagnosed with a grade 2 peripheral nerve injury. The grade 2 is classified as axonotmesis. So which of the following accurately describe the axonotmesis? Option A. It involves axonal damage and the Willidian degeneration. The Schwann cell is intact. Option B. It involves nerve function disruption due to demyelination and the axonal integration is still intact. In the option D, it involved disruption of the nerve function without axonal damage and the remyelination occurred within 3 weeks. So the correct answer is option A. It involved axonal damage and the linear degeneration. The Schwann cell is still intact. So here we have the explanation. The axonotmesis involved the axonal damage and the linear degeneration with intact supporting structures. In this type of injury, the internal structure is preserved, so the recovery is still achievable. In case of option B, there is a grade 1 nerve damage or neuropraxia, and in option C that refers to grade 3 nerve damage or neurotmesis. So let's jump to the next scenario. A 31-year-old female gave birth to the newborn with talip equinovarus involving the right foot. In most cases of the club foot deformity, which of the following is the most commonly involved? Option A, toes deformity. Option B, foot instep. Option C, ankle joint. And the option D, lateral malleolus. And the correct answer is ankle joint. Let's see the explanation. The ankle joint is the most commonly involved in the club foot deformity. The ankle is composed of 7 tarsal bones that group together to form the tarsus. The ankle is composed of 7 tarsal bones, forming a group of bones called the tarsus. It consists of talus, calcaneus, navicular, cuboid, and 3 cuneiform bones like intermediate cuneiform, medial cuneiform, and the lateral cuneiform. So let's move to another scenario. The brainstem consists of 3 areas: midbrain, medulla oblongata, and bones. The medulla oblongata is composed of all the afferent and efferent tracts. It is also called the center for the various physiological mechanisms. The following are controlled by the medulla oblongata except option A, blood vessel diameter, option B, breathing, option C, visual reflex, and the option D, swallowing. And the correct answer is visual reflex. And the explanation we have, visual reflex is controlled by the midbrain, which is option C. And the option A, B, and D all are controlled by the medulla oblongata. Breathing is also assisted by the bones. Sneezing, vomiting, and the heart rate are controlled by the medulla oblongata. Moving toward the next scenario, the deep veins of the leg and the pelvic are the most hospitable site for the venous thrombosis. Venous thrombosis is a condition where a clot forms on the wall of the vein. So which of the following vein is least likely involved in the deep venous thrombosis? Option A, peroneal vein. Option B, popliteal vein. Option C, posterior tibial vein. And option D, great saphenous vein. And the correct answer is option D, great saphenous vein. And the explanation is the great saphenous vein is a common vein that involved in the superficial venous thrombosis. The deep vein of the calf include the peroneal vein, popliteal vein, posterior tibial vein, and the femoral vein. A thrombosis in the deep vein is more serious than the thrombosis in the superficial veins because of the risk for the pulmonary embolism. So here we have the last scenario of this video. A 45-year-old female patient with angina is referred to the clinic after total knee replacement. The patient has a history of angina, which is usually relieved by the rest and intake of the nitroglycerin. The pain occurs with increased activity or stress. Based on these details of the information, the patient has which type of the angina? Option A, unstable angina. Option B, variant angina. Option C, transmetal angina. and the option D, stable angina. And the correct answer is stable angina. And the explanation we have, the patient has a stable angina because this type of angina is related to the myocardial demand. When the myocardial oxygen demand is increased, then it leads to cause angina. The option A is manifested by the angina at the rest, the angina which occur without any effort. The option B and the C refer to the same type of the angina. This is related to the coronary artery vasospasm. So that's it for this lecture, for the part 4 of this series, where you will find 5 more scenarios with explanation. Thanks for watching.